Hey everybody, this is James Gore, Sonoma County Supervisor. It's Tuesday, March 17th, and I want to give you a quick update on our Board of Supervisors meeting from earlier today. One of the big things on everybody's minds is this issue about a shelter-in-place order. Reminder that over the last couple days, 6 counties in the Bay Area and coming up to Marin County, just on our southern border, announced that they were going to move forward with shelter-in-place orders. And people have been asking about Sonoma County, what that means, how we move forward to it. So I'm going to get to that in a minute. But what I really want to start with is tonight, Sonoma County is hosting a virtual town hall. It's going to be in Spanish at 5 p.m. on KBBF radio, that's 89.1 FM, and also in English at 7 p.m. on KRCB radio, that's 91.1 FM and 90.9 FM. It'll also be on KRCB channel 22. I think that's under Comcast, and you can find it under other service providers. So there'll be more information tonight at that. That will include our Chair Supervisor Susan Gorin, our County Health Officer Dr. Sundari Mace, Barbie Robinson, our Director of Public Health, Chris Godley, our Head of Emergency Services. So with that being said, I want to get to the point. In our meeting earlier today, Dr. Sundari Mace, our County Health Officer, stated that she is looking to move forward under the Public Health Authority with a shelter-in-place order for Sonoma County. The goal in doing this is to basically flatten the curve. I know that's a high-level statement, but what it means is that as those in the world of epidemiology, which is disease identification and spread, as they go through how you manage a pandemic or a local infection of this nature, the goal is to flatten the curve so you don't get above the level of what health professionals can provide. We have to be in a situation where we can assume that quite a large percentage of our population, from what we've seen in China, from what we've seen in Italy, from what we've seen in South Korea and in Iran, that a large percentage of our population can get or be diagnosed with the coronavirus. If we don't get ahead of this quickly, the coronavirus could be in our community very well for a year before we move into a situation where we have vaccines available to us. But the big point is to even out the curve and to limit the amount of transmission and transaction right off the bat and get us into a good situation. So what does shelter in place mean? Well, as we've seen promulgated out by those Bay Area counties, it means that you stay home as much as possible. It means that you don't work unless you are an essential employee for an essential service. And essential services can be everything from grocery stores, food distribution, food production, food processing, pharmacies, public safety, as in fire, police, other services, sanitation, banks and finance, and as I mentioned before, food and agriculture, which is a big part of what's going on. What folks have talked about recently is that the focus here is on what kind of enforcement. People wonder, how will this work? Well, the first thing is that this is about voluntary compliance on the first and foremost basis. Violations of health orders could be taken up to a misdemeanor level, but that is a situation of last resort. We've already seen those statements made by the law enforcement individuals in those Bay Area counties, and here in Sonoma County, I'm sure it'd be the same thing. The goal is what they call compassionate enforcement, which means basically get off the roads. Don't put yourself in a position where you're around a lot of people. Don't put yourself in a position, even if you're young and you don't have a problem with having the coronavirus in the sense that it would hospitalize you. You don't want to be a vector that ultimately goes after and interacts with a lot of people who are over 65, who have pre-existing conditions. So I do anticipate that our county health officer promptly will be announcing a public health order, a shelter-in-place order. We will make sure that we identify as best as possible the essential services that people will be able to continue to get out and do work in the community. The goal here is to do as much telework as possible. The goal here is to, if you're a parent and you have your kids out of school like I do, my wife and I have already set up our own program in our own house. That includes them not staying in their pajamas all day. It includes them getting up and us having a schedule for them so that they can stay focused and doing things. We can also, like maybe this afternoon, we're going to take them to a park. We're going to make sure that we're not close to other people, but we're going to enjoy outdoors. We're going to walk our dog. We're going to live our lives. But at the same time, what we're going to do is make sure that we are not a part of the problem. We are going to make sure that we take this seriously. And I want you all to take this seriously. I've gotten 1,000 different emails over the last couple days with people who want specifically identified their work, their service to be designated as essential, because it is essential when you're worried about your profit margin. It is essential when you're worried about making ends meet. But at the same time, we have a huge issue before us, and it's a novel coronavirus. When it says novel, what that means is that it's new. It means that our bodies do not have built-in immunity towards these. It means that we do have to wait until we have a vaccine come on, which is still 10 to 12 months away. So the biggest thing here is that I'm a politician sharing as a community leader the best information I have without getting too far out over my skis. At the same time, I want you all to know that this shelter-in-place order, I am following the direction of the county doctor. That's our county health official. Just like you and I and our families go to a doctor if we have an issue and we say, what's the diagnosis? For me, the goal here is not to be a politician picking winners and losers, and it's not for my colleagues as well. It's us looking at that person who has a background in epidemiology and disease spread and disease management and saying, what's the best thing we can do? And what they're telling us right now, under their authority, they're going to enact and look at moving forward in the coming days is a shelter-in-place order. And what that's going to do, once again, is make sure that we're doing everything we can to not have catastrophic spikes in the novel coronavirus anytime and now and over the next coming weeks, so that we get ahead of it and we do containment and mitigation before it gets ahead of us. I want to thank you all for being a part of sharing awareness and sharing education and not sharing fear. But we have to be willing and open to talk about this and not hide from it. If you have any questions, please contact my office always, District 4 at sonoma-county.org. That is District the number 4 at sonoma-county.org. Also, please get all of your information from socoemergency.org. That's SOCO emergency.org. And if you have questions by phone, we're referring everybody to our phone system service, which is not 911 for incident emergencies, it's 211 for vital information. The folks there can route you and reference you towards important information. In addition to that, I want to just say Sonoma Ready is what it's all about, to be Sonoma Strong. We've been through a lot of things over the last 4 to 5 years, and we don't know what the future holds, but we do know we live in a beautiful place that we cherish, and that we're going to take care of our families and take care of those most vulnerable in our community going forward. So thank you very much. Once again, be in touch with us with any questions, but understand that we as politicians are taking the advice of our doctors just as much as we as individuals take the advice of our doctors as well. Thank you.